Hey, good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live from the Dolph Simons Family Studio. Delighted to be back with you on this Wednesday morning as the feeling of spring is right there. You can feel it in the air. What a gorgeous day yesterday. A little cooler today, but man, it feels so much better than it has. Hey, our special guest today is President of the Black Healthcare Coalition and Kansas City Councilwoman Melissa Robinson. Melissa, welcome. She's joining to update us on efforts to help the vaccine hesitant become vaccine willing in the African American community and overcome concerns, because we don't want folks, you know what we say from the line from Hamilton, do not throw away your shot. But first, Doc Hawk, how are we doing?
Yeah, we're doing good. As of 7 a.m. this morning, our acute infections, decreased quite a bit from where they were yesterday. So 27 acute infections, which is really good.
We like it.
Seven of those in the ICU.
We need to get like a celebratory track, like cheering as we hit these milestones.
So smaller proportion in the ICU, just 7, and then 5 on the ventilator. So still a lot on the ventilator in the ICU. But we see those numbers fluctuate.
They've really dropped overall.
Yeah.
I mean, we were like 30 on the ventilator, 20 on. I mean, we had high ventilator numbers. We're way down from that. So.
Only utilizing one ICU now for COVID patients, which is a good thing. 33 in that recovery phase as well. So Hayes is doing good as well. 16 total patients with 10 active and 6 in that recovery phase. So overall, the numbers are pretty good, and I think around the region here in the metro area, the numbers
were down from them. So we love the trend. But here's a big concern, of course, we have. We always want to temper our enthusiasm. The big concern is we've been kept inside by the frigid polar vortex, and now it's warming up. Yeah. What is that going to do to group gatherings, people wanting to go back to restaurants, people wanting to go out and get together again, having people over? Remember, the rules of infection control. What do? They travel with you
all the time,
wherever you go. So don't throw away your shot, and don't go do anything that's going to start spreading COVID again.
Continue to reduce and mitigate that risk.
I love it. Okay, well, before we jump into our discussion, are there reporter questions this morning?
I have one from the Kansas City Star.
Please.
Katie Moore was wanting to know, and I think this really is a question for the Councilwoman Robinson. Is the health system expanding its outreach to ensure vaccine equity in the community, especially for populations that are underserved, have been hit harder by the virus? Kansas and Missouri are allocating their doses differently. Last week, the KC Health Department got 800 doses. In comparison, Johnson County Health Department got 8,190. Should local health agencies in Missouri be getting more of the available doses? Does this impact equity? So a lot to unpack there.
Great opening question. There's a lot to unpack this question. So I'm just going to turn to the Councilwoman, because I think we're going to answer that question, but it's going to take us a little bit of time to answer. It's a great question. So welcome, Councilwoman. Thank you for joining us. We know your work as a councilwoman for District 3 in Kansas City, Missouri. I live in Kansas City, Missouri, so thank you for your service. Please tell us a little bit, though, about the Black Healthcare Coalition.
Sure. The Black Healthcare Coalition is a local nonprofit organization that has been around for over 3 decades, and we serve the greater Kansas City area. Our theory of change is that if individuals have access to quality health care, if they have the right information regarding health promotion, and they have great advocates as it relates to changing health policies, then we can impact the health inequities that we see within the African American community. We focus on underserved populations, and right now we've launched a campaign called Is the Science Safe? We've been doing Facebook Live events and other programs to educate community members around the safety behind the vaccine. Oftentimes people say, well, why aren't you just saying the science is safe? Because we know that it is. However, when you have a population that has deep distrust of the medical delivery system, you have to make sure that you give them the information, the knowledge, the education, and allow them to make those judgments and decisions for themselves. And having that self-actualization is so critical and key. So we work a lot on health disparities, and we have an amazing program with KU, the Alzheimer's Disease Center, in addressing health inequities related to Alzheimer's. So we're happy to be on the program, and we're happy to talk about vaccine hesitancy.
Well, and we're delighted to have you, and thanks for the shout out to our Alzheimer's disease program, which is a great program. And you know, Alzheimer's patients are affected a lot by COVID-19, so that is a really good thing. How long has the Black Healthcare Coalition been around?
Sure, we've been around for 32 years now. We were started by a group of African American physicians who, because of the advent of 70 Highway, a lot of them moved out of the inner core of the city because they had the means to do that. However, they were still attending church in the African American segregated communities, and they started these health clinics, church-based health clinics, to give back to the community. So that's how we got our start. We worked a lot on the HIV/AIDS epidemic and addressing the stigmas related to that in our early years. And we continue on to really work to address all of the health inequities. And we do that, again, through three ways: access to care, health promotion, and policy and advocacy.
Yeah, what a great plan. And so, you know, there has been institutionalized racism, obviously, but also medically institutionalized racism. Talk to us a little bit about that. I mean, I clearly know about it, but I'd love to hear your perspective about that.
Certainly. We just, on our last program that we did regarding This Is a Science Safe campaign, we talked a lot about the Tuskegee syphilis experiment, which a lot of people don't know that ended in the 1970s. So that's not really too far as it relates to history and the distrust that many African Americans feel when we talk about stories of Henrietta Lacks. And then when you fast forward today and you sit in medical classrooms and you hear the future of medicine and those individuals who are training to be doctors and nurses. And when we talk about the risk factors for hypertension or diabetes is simply being African American. When we think about how our future physicians are being taught about how African Americans respond to pain or other stereotypes or biases that are brought up during that training period. The other thing that we have to deal with is oftentimes physicians consider African Americans non-compliant. And we believe that there is no such thing as a non-compliant patient. There's only there's not a compatible treatment plan. And so we have to work to make sure that individuals are educated about chronic disease states, their risk, and how they can have productive conversations with medical providers. But we have to do that on both ends with people that are providing care and individuals that are seeking care.
Yeah, that is really valid. And just to say, for our audience who don't know the story of Henrietta Lacks, those are HeLa cells. The HeLa cells were harvested from Henrietta without her permission and knowledge and consent back in the 30s, am I right? There's about the 30s or 40s.
Yes,
I can't.
Around that time. Yeah,
Johns Hopkins actually, and then those cells became. I believe she had ovarian cancer, and I think they were rapidly producing cells, and they were harvested, and they became the backbone of a lot of scientific experiments. And those HeLa cells, Henrietta Lacks, again harvested without her permission or knowledge or consent, and so that's not an uncommon story in with how American medicine has treated the African American community. And so I think it's especially prescient for us to talk about it around the pandemic.
Absolutely, because when we think about, again, just the trust factor is so critical. And when we think about the clinical trials that were necessary, people say, well, this has been created from an emergency standpoint. Yes, it has. However, there were the most amount of people of color participating in the clinical trials for the vaccine than many other clinical trials. And so one of the things that we're doing with the Alzheimer's Disease Center is establishing a Black Research Institute so that we can get more African Americans involved in clinical trials so that they can have exposure and education about the internal review boards and all of the consents that are necessary so that we can connect our history to the change that has been made in in the science, and so that it will increase our confidence. And then also help with better treatments, obviously. So individuals that are dealing with diabetes or hypertension or things of that nature, and we have to participate in those treatment protocols because we want to get better, but oftentimes we're not in those clinical trials. And so we're working to address that as well head on. The news media had asked a question. I would love to get back to that.
Please, we are definitely going to get there. So let's hit that. And I want to give our perspective and your perspective. So let's do it.
Absolutely. And so we are very hopeful as things have been turning around related to access to the vaccine in our LifeX zip codes. And our LifeX zip codes are those zip codes where life expectancy is lower. They're typically, again, are continually segregated communities where poor people and African Americans and Latinos live. And we just yesterday announced a partnership with the pharmacy in which we'll be able to vaccinate a multi-week vaccination clinic at the Linwood Y, and they're going to do 250 people a day. We know that our Safety Net Hospital in Kansas City, Missouri, Truman Medical Center has been working to vaccinate individuals at our local churches, and they've been doing a yeoman's job. However, access, again, has been an issue, and that's opening up. Our health department, for the first time, we got 3,000 doses of Moderna yesterday. So we were all doing the happy dance and are glad that we have a vaccine task force that will help us with the logistics.
And just to say, I want to join your shout out to Truman. They have done a great job in testing initially. They went into lots of communities that did testing where others didn't, and they have just done a great job. And that's part of their mission, but they really, I think they walk the walk, and so hats off to them. I think the story that we've struggled with a little bit is that when we got our vaccine, it was really for our employees. And then once we had vaccine hesitant amongst our employees, we started contacting Johnson and Wyandotte County. Wyandotte is pretty well organized, I think, to reach into communities of color and into poor communities because they have their own plan for vaccination. And remembering that the health departments routinely, this is what they do. They find people who aren't visible. They find people in the homeless shelters. They find people in Concord. They do things that hospitals don't really do on a regular. Let's just be honest. We don't really do that like that. We receive those patients when they're sick and are happy to take care of anyone. But the reality is that when you're trying to do a health prevention program, the health departments are well suited for that. And I think Wyandotte's done a great job around that. They've got a vaccine plan, and I think they work hard to get into communities, work with, African American, Latino ministers or whomever to try and make sure that everybody's represented. The other thing now from our end, what we've done once we've been part of the vaccination program for Johnson County, so Johnson County doesn't have the same degree of mass vaccination that Wyandotte had. Johnson County is working with Olathe, Advent, and KU to try and help supplement their county program. And so Johnson County, what happens is we've worked off our patient list, and we use a lot of electronic outreach, both through what we call MyChart as part of the EMR and email. We quickly found out that there are a lot of people we were missing, and so we've started doing mail and phone calls. And that's who we are, and that's our ability to do it while relying on health departments to do other types of reach out into communities. I think what we're going to see, right now the biggest problem is vaccines so darn limited, but as vaccine ramps up, it will take all of us to get people vaccinated, including churches, pharmacies, primary care, the health departments, and people like the Black Health Coalition going out and advocating and trying to get people involved, because we do have years of institutionalized racism in healthcare to overcome on this program if we're going to help keep each other safe.
Absolutely. And I'm so glad that you're bringing up these pieces, especially when we talk about the health department and our federally qualified health centers.
And I should have said that. Yeah, Vibrant Wyandotte has done a great job. Swope and Samuel Rogers and KC Cares. I mean, there's some really awesome FQHCs and some lookalikes that are doing a big part of this.
Absolutely. And that's why we were a little disturbed when we started knowing that our hospital systems were the only ones that had access to the vaccine because of the so many patients that are rooted within our safety net system, the hospital as well as the clinics, and like you said, the lookalikes as well. We are also very not only happy that we're getting more vaccine, but also that we have the intelligence and knowledge of just folks that are coming together saying we will help you put together a plan. There's a regional effort, Come Back KC, and I want to shout them out as well because they, had us reach out to our local election board and to say, when we get the vaccine opened up, if we can set up vaccination sites that are similar to how elections run, then we can make sure everyone has access to the vaccine. And so we're just really leaning and depending on a lot of smart people and people that have a passion to ensure that everyone has access.
Yeah, leaning on and leaning in. We have to lean into this problem and solve it. And I think that you're right. The FQHCs, I'm on the board at Vibrant, and that is just a great organization. Swope, what a great organization. And people who are dedicated, Samuel Rogers, KC Cares, and those, gosh darn, I forgot the one in Johnson County. I should know that. It'll come back to me. But all of these are doing great work at moving into communities and getting in contact with people. Now, the struggle has been that the lack of vaccine. So in Kansas, vaccine goes to the health departments, and then the health departments get distributed. Now, the FQHC's got some doses originally, but haven't gotten any doses lately. I think as vaccine production ramps up, there will be multiple modalities, hospitals and health system, county health departments, federally qualified health centers, and other groups like that. By the way, the VA has done a great job of reaching into the veteran community.
Amazing.
They have a very high rate of vaccination. So a shout out to the VA. Ahmad Batrash, who's the chief medical officer over at the Kansas City VA, and I were talking yesterday on our CMO call, and they're ahead of the rest of us on getting people vaccinated.
They're doing an amazing job.
They have done a great job, and veterans of all sorts and all communities. So good work. And then the pharmacies and there are pharmacies in all sorts of communities. And so I think that is another thing, and it will take all of us to get this done. The U.S., let's be honest, we have not had the best response in this pandemic. But I think as we come back, I think we will have learned a lot. And hopefully we will make an investment in public health infrastructure that allows us to handle this, not just for major things like pandemics, but for the ongoing things, the ongoing issues that that people face on an everyday basis.
Allowing policymakers to interrupt the planning that has been done. I think that's when we're looking back and how we've responded so far, it's really important to look at the everything that you all have planned for up until this time, that we're able to follow those plans.
Yeah, it makes a difference, doesn't it? Okay, Jill.
Yes.
We could sit here. I could sit here talking to Councilwoman all day. I know we have to go ahead and open up to questions.
Yes. All right. So Caprell wants to know, what about the African-American population in the correctional facilities? I'm hearing that not very many are wanting the vaccine. Is there any outreach to overcome their vaccine hesitation?
Councilwoman?
That is an awesome question. I'm very glad that that's been brought up. We did a hour-long interview with Dr. Virginia Kane, an African-American physician who's over a public health department in another jurisdiction. But we are working with that information, that collection of interviews with her, to make sure that those get into facilities like our correctional facilities, but also ensuring that there's a protocol in place for them to actually have access to the vaccine. The thing we don't want to do, especially in those confined situations, is to give them the information, the education, and the science behind the vaccine, and then there's no available access. The other thing that we're working on is with our child care facilities and ensuring that we're giving information to the parents of children so that they have access to that education. We've come up with 5 reasons that African Americans should seriously consider the COVID vaccination from authored by an African American physician, Dr. Nevada Lee, here in Kansas City. So we're just looking at different ways that we can educate the public. We'll be working with the media outlets in terms of print newspaper and the radio. And we're always looking for ambassadors. We're always looking for people to share their stories and to help people make those decisions.
Yeah. And I would like to say, too, Secretary Norman has mentioned a few times, Kansas is, they have a priority on prisons and all that, because we know how devastated some of those prisons have been, not only the guards, but the people in there as well. And so that is a huge priority for KDHE as well.
It's interesting. The last outbreak that he talked about, it was people from the community bringing it into the guard. People who were working in the prison brought it into the prison, then the prison spread, and then it got back into the community. So it becomes this cycle, and you have to interrupt the cycle. And I know folks will say, "Oh, they're prisoners; they don't deserve to have the vaccination." And we all deserve to have the vaccination, and to think that you can isolate a prison and not have that infection affect a community is just that you just don't understand enough about how disease is transmitted, because it will absolutely go right back into the community, or the community will bring it right back into the prison. And in congregate living settings, you really have to, you just have to vaccinate people.
And it just goes back to, you're only strong as your weakest link. And if you have a large number of people that are in that setting, you have a large amount of viral replication, can a new variant arise then? But overall, the thing is, to your point, it can get back into the community very easily, and so it is important for.
And we know that vaccine production. We heard the news this morning about Johnson & Johnson. It looks effective. Is it as a wow bang as Moderna and Pfizer? Maybe not, but it was extremely effective at preventing hospitalizations and severe disease. So the reality is, that's great news, as good as we could have hoped for. And I thought there was some preliminary data that suggests maybe pretty effective against the variants too. So it's very early. It's just breaking right now, but I'm excited, Hawk.
Yeah, I think it'll be good. If we can
and it's one shot.
Fully review it and it gets emergency use authorization, that is going to add a lot of supply to the United States.
It is, and that will allow us to vaccinate all communities, and especially for folks who have difficulty following up, either for economic reasons or whatever. Getting one shot can give you the protection we need. That is a big win for all of us, I think.
Okay, Susan has a question. The question is, how do you convince someone like my partner who got the first dose of Moderna and has mild symptoms to get the second dose? She goes on to write that he's read studies where I had COVID, I got my first shot, I don't need the second shot.
No.
That's controversial, but I think we would still say, go get your second shot.
Yeah, I would disagree. I wouldn't say there's studies saying that. There's probably articles and anecdotes and
there's some stuff been pre-release out of Israel and other places kind of address this, but it's not. It's with you. It's not full study.
To Dr. Fauci's words, all the data is with the 2 doses, because we know that with the 2 doses you can get that immune boost of that specific adaptive immune system, but also that durability. We don't know what the durability is with just one, so it's definitely recommended if you got the first dose, you should need to get the second dose.
Do you think some people act like, well, I got COVID, that was my first dose, so my first vaccination is really my booster dose? Do you think there's logic to that?
There could be a little bit of logic, but we just don't have the data and
we don't really know
truly
the answer.
Understand that.
Yeah. Maybe they should all wait to get the J&J dose and they don't have to worry.
No, just wait.
Okay.
Kay wants to know, after you've had both shots, can I have people over for dinner?
Well, we are waiting. We heard that the CDC will maybe do some fully vaccinated persons guidance, and so we'll have to wait and see, how that goes. I would hope so. That would be one step to get back to normalcy.
Do you feel safer? If you had a dinner with 4 people and they'd all been vaccinated, do you feel safer? Because I feel safer with that.
I would probably feel a little bit safer.
Yeah, I would feel safer, but I don't. Does that necessarily make it safe? And here's our struggle. Because we don't yet know if when you've been vaccinated, that prevents you to spread the disease. So if you have 4 people over and somebody has COVID, you likely won't know it because they won't have symptoms. And then you give it to someone and then they spread it, they take it home to somebody who's older and hasn't been vaccinated. That's our problem, right? And again, Councilwoman, in vulnerable communities, that can spread pretty fast.
Yes, absolutely. And we just really have to, again, listen to and take the time to understand how things work, because it's not that you can't get COVID and you can spread it on. And so we have to be a little bit more patient and be diligent and follow the advice of trusted people like yourselves.
Well, I don't know if we're trusted or not. That you are very kind to say that, but I think the message would still be the same one. The rules of infection control still need to travel with you. Do I feel safer? Yes. Do I feel safer going to a restaurant? I do feel safer because I know that I'm protected. The question is, have I protected everybody else? And to that point, masks, distancing, hand washing, it still works, people.
And I think that if new guidance does come out on fully vaccinated persons, I think it needs to be, pretty simple and not confusing, because even the quarantine guidance that has changed for fully vaccinated people, I think it's 90 days from your second dose, but you have to make sure you're 2 weeks from that second dose. So it ends up being about 10 weeks, and it's just confusing if you're trying to do the math. I think once people get their second shot, they are just going to kind of throw caution to the wind. For most people.
And you know what that guidance is from the FDA, or the CDC, when they say that really it's 2 weeks after, but it's 12. That's just a whole lot of I don't know.
Yeah.
Right. And so they're trying to be this very conservative thing, but it is confusing.
Catherine writes, the vaccines, she understood you to say, are reducing hospitalizations and death, but is there any information on whether they are also lessening damage to lungs, to heart?
So that's a great question. And here's what we know about Moderna and Pfizer, at least. The answer to that is yes. Because what happens is if you have damage to your heart and lungs, you come in the hospital. And so the fact that you're not having to come in the hospital means you're just, you're asymptomatic. You're just not having the same degree of damage. I think we could say that pretty safely.
Yeah,
I think that the question of the J&J vaccine, we just don't know enough about that with Johnson & Johnson. We just don't know enough about it yet. I read the headlines today and tried to go read some stuff before I got here because it broke like 15 minutes before I came down here. So I'm busily trying to figure that out. I walk in 3 minutes late. Jill gives me the evil eye. She's like, where you been? Because I've been trying to read about this J&J vaccine. So I think we just don't know enough information about that yet.
But I would agree with you, and I think understanding what we understand about the immunopathogenesis, meaning how the virus or the disease affects our organs, a lot of that has to do with because we don't have an initial immune response, and the virus evades our initial immune response. So you have a lot of viral replication, and then your immune system is just playing catch up. And if you don't have things such as a good T cell response, you have another arm of the immune system working overdrive. And I think it's really when you have this immune dysregulation, you have a lot of the damage done to the heart and lungs. But if you have an immune system that's been created by the vaccines, you're not really playing catch up as much as you are just from having initial infection. So I think we could probably say that, it probably will reduce lung and heart damage, other organ damage.
No, we know it does because we're not hospitalizing people so much. And even in our own employees, when they do get sick, they're not getting sick. So we have a pretty good window into that, too.
Jill and John are asking kind of the same question. Jill says, I'm curious about the percentage of deaths from acute infections in our hospital right now. And John is wanting to know, do you think that the therapies that we're giving is helping to reduce the hospital length of stay?
Yeah. We can look at some more of that data here on Friday. We'll ask Dr. Wild to bring some of that down. What I know is our death rate's running around 9 to 10%, which is where it's been for months. So I think that it hasn't really changed. If you get sick and you're hospitalized with COVID, that just means your risk, once you come in the hospital, of dying is about 9 to 10%. Once you go into the ICU, your risk of death goes up to about 30 to 40%. And so that has not changed over the last several months. Is it better than when we started? Yeah. I think there's a lot of reasons for that. I think some of the therapy is more effective, Hawk, and you can comment on where we are with some of those therapies. And so we're better. But we're also better because we're not as overwhelmed. And I think that has made a difference because you could just provide better care for people when, your nursing ratios, your respiratory therapy ratios, all those things are right because you're paying enough attention. And when you get overwhelmed, you just, you have to start making triage decisions, and then things don't go as well.
I would agree. I think you have the non-pharmaceutical treatments, which is the ability to care for the patient. So it is nursing, staffing, the ventilators, the critical actions that you need to be taking in the hospital. Then you have the pharmaceutical. We know that as far as capacity and vital drugs when you're on the ventilator, we have those now. We were, there was a possibility of running short early on in the pandemic. I think as an outpatient before you come in, early in the disease, if you can get the monoclonal antibodies, we have shown that has reduced your rate of death and hospitalization. And then when you come into the hospital, again, early is always but once you come to the hospital and you have the disease, because a lot of people don't come to the hospital for like 10, 14 days after the initial infection or their symptoms. And by that point in time, we're really dealing with that immune dysregulation, the damage to the lungs and the heart that we've talked about. And by then, it is very difficult. So, but I think overall, our ability to care for patients has improved, but the death rate remains the same. But it could be for a variety of reasons. Again, if you have symptoms and then it's not until 2 weeks later till you're really feeling bad till you go to the hospital, by that time you probably have a lot of damage to your lungs already. So
I would also say, I think one of the things, I'm going to come to the councilwoman about this too, one of the things that we have seen is our number of patients coming out of nursing homes has dropped a lot. And that's because so many patients in nursing homes are now vaccinated. Yeah. It's making a big difference, which is probably why I think our ICU numbers are down. Yeah. Councilwoman, there are nursing homes here that have, in Kansas City, have a lot of African-American patients. How's vaccination gone in there, and what's the vaccine hesitancy like?
There is, again, some difficulties as it relates to access to the vaccine with that population, as well as the hesitancy. We are working with State Senator Barbara Ann Washington to address that, and on March the 6th, she's launching some initiatives to ensure that our elderly that are in nursing homes, and then also those that are in those independent living centers as well as trying to work on one population that provides medical care or these medical assistants that go in and do home care. So ensuring that those that are receiving in-home care that are elderly, as well as those who are taking care of them, are vaccinated as well. So there's a lot of populations that we have to focus on. And to your point earlier, it's going to take all of us to make a difference.
And Councilwoman, is the rate of vaccination in predominantly black nursing homes lower? I mean, is there less vaccine being offered, do you think, compared to other nursing homes?
I believe that the vaccine is definitely available to individuals that are in nursing homes. So, for example, Truman has done a great job with reaching out to those facilities. But you also have to remember that folks that are immobile, and we just started doing vaccines outside of the medical facilities maybe like 3 or 4 weeks ago. So, and there's just such a huge need that's there.
Yep. I don't know because I just didn't know how vaccine was getting into nursing homes in Missouri as well as I know it in Kansas. And so I know in Kansas the state said that's the first group we're going to go vaccinate. And I don't remember what it was in Missouri. So
we have time for 2 more questions. Craig's question is there any protection 10 days after the shot?
Yeah, I mean, I think you start to develop an immune response, particularly antibodies. But we know from Moderna and Pfizer's early studies that people were still getting infected. And when you look at those infection curves after that first dose, after about 12 days, you can see that curve start to separate from the people that just got saline or the placebo compared to the people that actually got the vaccine. So I think you really start to have a good protective effect after about 12 days, but probably after about 10 days, you do have some antibody response that is going on. We know that by 10 days in natural infection, many of the people seroconvert, meaning they can detect antibodies. But really, for full protection, you need that 2 weeks after the second dose. But I think there is some protection that's afforded even at that 12-day mark or so based on that data. But you're not fully protected, and we know people can still get infected at that point.
Last question.
Yes. Barbara wants to know, I have read and heard many times that reactions to the vaccine are normal and even a good sign, but what if I don't have a reaction? Am I protected?
I think you're still protected.
Yeah, you're lucky if you don't have a reaction. That's a good thing. But there's no correlate of reaction after vaccine to immune protection. So if you don't have a reaction, I think that's good. You are more than likely, you're still going to be protected. So I would not fret or worry about that.
Hey, I'm going to turn to our guest for her final thoughts here for in just a moment. But I do want to give you a little bit of an update about tomorrow, who's going to be on our program. These are a really special guest. You're seeing her right now. Michelle DiMartino is part of our MMU family, our Morning Media Update family. She's the owner, though, of Beyond Interpreting. and she has also suffered unfathomable loss in her family during this pandemic. Both her mother and father have joined over 500,000 Americans who have died from COVID-19. They passed away recently, within days of one another, from this terrible pandemic. She joins us to share her cautionary tale. With her will be psychologist Greg Nowalnik to talk about overcoming grief and fear during this pandemic that is still with us for some time to come. We want to say a special shout out to Michelle for having the courage to be here. Thank you for that. Councilwoman, thank you so much. This is Melissa Robinson. She is the president of the Black Healthcare Coalition and a Kansas City Councilwoman. And I want to turn back to you now. Your final thoughts from today, and thank you for being on the program. What a great guest, and you're welcome back anytime.
Thank you so much for having me, and also to Michelle. We love you here with the city of Kansas City. She provides assistance to our mayor as he's been giving updates as well. And she is such a jewel, in our condolences to her and to your family, Michelle. We want to certainly let individuals know that the Black Healthcare Coalition is here to assist and to help, but our most important thing is that we're able to get to influencers in the community that can help influence people to make good decisions about their health care and their safety. We want to work with our barbers and beauticians and our faith leaders and all of those individuals that have strong networks. And so we would encourage people to reach out to our organization on Facebook or give us a call or any social media handles. And just together we can make sure that we educate, that we inform people that the COVID vaccination is safe, and the rewards definitely outweigh the risks that are associated. And so we appreciate the opportunity to join you today, and we want to thank you for all of the education, the continual education that you're providing individuals to help them understand that the science is safe.
Councilman, thank you. And I think the members of District 3 for Kansas City, Missouri are well represented. We are delighted to have you on our program today. We'll get you back.
Yeah.
Hawkeye, final thoughts.
Yeah, go back and read the J&J data. Hopefully, their evaluation is coming up soon by ACIP, and if it looks to be safe and efficacious, and it's emergency use authorized, we will have a lot more supply, and we can get that vaccine to as many people as we can, the general public, all of those communities, all of those groups that really need it, those vulnerable groups, and really keep everybody safe, make one more step towards normalcy.
Boy, that'll feel good, won't it? You know, this has been a really special program, and we're going to have a couple in a row. I just can't tell you how much it means to us to have Councilwoman on this morning and her story of what's going on in the African-American community, and remembering the story of Henrietta Lacks and going all the way back to those HeLa cells and having things happen to you without permission. And yet trying to how we address and overcome those barriers today. This has been a terrible pandemic, and tomorrow we will personalize it in a way that we haven't yet on this program. Maybe we have some with Anil and a few other folks, but to have Michelle on there and talking about her mom and dad, that will be a hard moment for all of us, mostly Michelle. But what we know is this, that faith, hope, and science work together. They'll help us get through. They've already helped us come this far. And as science begins to help us win, as we feel the effect of it taking off, we can have faith and hope in tomorrow. It'll be a little better than it has been today. So be with us tomorrow as we celebrate life, we celebrate what we can pull out of this and what we can be. Thanks for being with us today. We'll see you tomorrow.